What got me interested in the LANAP protocol was the least invasive way of treating periodontal disease. So I was interested in another method of approaching a lot of the problems that my patients were coming in with to deal with their bleeding gums and their bad breath and their loose teeth, which is the three major signs of periodontal disease. So once I was able to understand that a laser would be an easier method for patients to be able to undergo a surgical procedure, I jumped at the opportunity to try to implement it into my practice as a first-line treatment for these types of patients. There's one patient that absolutely stands out in my mind, and it's a patient who came in with a lot of periodontal problems. He had been avoiding going to see his own dentist for decades because he knew he had a problem. He just didn't really want to know how bad the problem was. He really felt like he was going to be losing a lot of teeth. And so we talked about some of his options that were available to him, and I felt as though, again, from a first-line treatment, this would be a really great option for him to be able to see what we could achieve with something that was really not invasive for him. And we went with the full LANAP procedure, and it was wonderful. His post-operative discomfort was minimal. We had him on a handful of anti-inflammatories. That was really about it. We changed the way he was rendering his home care, and his outcomes were really tremendous. His teeth that used to be mobile had tightened up. They had actually migrated and they moved into a better position. He was elated about his ability to begin to eat and chew and bite into foods that he hadn't been able to do for years. So that's probably the most memorable patient that I've treated thus far. So I think the training program is actually quite important to my clinical success thus far because it's allowed for me to have a greater confidence in terms of beginning to use the laser over the past year. I'm less apprehensive about taking a patient down the laser route versus the traditional route. And it's allowed me to also expand upon a lot of the procedures that I'm doing with the laser beyond just the LANAP protocols. So I think that the laser is a wonderful item that I have added into my practice in terms of allowing me to expand the procedures that I deliver to patients and to allow for them to choose between different degrees of procedures. And I would recommend that other periodontists get it so that they have the ability to offer patients other routes of treatment where they weren't able to do the same before.